Is muscle edema a sign of muscular dystrophy on MRI? When considering whether muscle edema is a sign of muscular dystrophy on magnetic resonance imaging, it is essential to understand what muscle edema indicates. Muscle edema can indeed be a sign of muscular dystrophy, particularly during the early or active phases of muscle degeneration. In these cases, muscle degeneration often includes a period of edema before muscle tissue is replaced by fat. Magnetic resonance imaging is capable of detecting this edema as an increased signal intensity on fluid-sensitive sequences, such as T2-weighted images with fat suppression or short tau inversion recovery sequences. This increased signal reflects higher free water content in the muscle tissue, which may be linked to inflammation, muscle fiber damage, or issues with the muscle cell membrane associated with the disease process. Research indicates that in various forms of muscular dystrophy, including limb-girdle muscular dystrophy, muscle edema is observed as part of the disease progression. This edema may appear before fatty infiltration and muscle atrophy become more pronounced in chronic stages. The presence and pattern of edema can help characterize the stage and activity of muscle damage, which may vary depending on the specific type of muscular dystrophy. However, it is important to note that muscle edema seen on magnetic resonance imaging is not exclusive to muscular dystrophy. It can also be caused by a wide range of other muscle disorders, including inflammatory myopathies, infections, trauma, or ischemia. Therefore, findings of muscle edema on magnetic resonance imaging must be interpreted alongside the clinical presentation, laboratory tests, and sometimes muscle biopsy results. In summary, muscle edema on magnetic resonance imaging is a significant imaging feature that can indicate active muscle damage in muscular dystrophy, especially before irreversible fatty replacement occurs. It serves as a useful marker for disease activity and progression, but it is not specific to muscular dystrophy and requires careful differential diagnosis. Practically, using magnetic resonance imaging to detect muscle edema can assist in early diagnosis and monitoring of disease progression. It helps differentiate muscular dystrophy from other muscle diseases by assessing patterns of edema, fatty infiltration, and atrophy. Tracking changes in edema over time may provide insights into the effectiveness of treatments or interventions. This aligns with current medical understanding that magnetic resonance imaging is a valuable, non-invasive tool for evaluating muscle pathology in muscular dystrophy, complementing clinical and histological assessments. Always consult healthcare professionals for personalized medical advice and to understand the implications of imaging results in the context of individual health.